Hi, everybody. Welcome to A Healthy Dose. I'm your host, Kelly, a physical therapist here in West Caldwell. And today I am joined by Dr. Greg Josephsen, who's a dentist at Josephsen Family Dentistry in West Caldwell. Thanks for being here, Dr. Greg.
Hey, Kelly, it's a pleasure.
Awesome. So, Greg, let's get right into it. Who do you help?
We help anyone in our community who needs us. The old adage around here has been ages from 2 to 102. And that is quite literal. We've had patients who are 2 and younger, and we've had some who are 102. I don't know if we've had any older, but we've had some that are 102. Anyone in our community, we're family practice. Love to see kids, love to see people of all ages. So we're here for the community, just to help as a resource.
Awesome. And you practice as a general dentist, right?
Yep, I'm a general dentist, which means we do a little bit of everything. Like I said, we'll treat kids, we treat the entire family. We'll do Invisalign treatments for people. We do pretty much you name it, we'll do it. Absolutely.
Cool. How'd you get into dentistry?
I got into dentistry probably about my junior year of college. I was a biology major, and I wasn't quite sure exactly what I wanted to do. I considered, before biology, I considered architecture, engineering, that sort of stuff, which I kind of learned in high school that wasn't for me, because I'm good at math, I'm good at physics. Didn't really enjoy it so much, and I didn't enjoy that I wasn't really, at least in the preliminary portions of it, high school, that sort of stuff. The courses I took, it didn't involve a whole lot of interaction with people. It was a lot of numbers, a lot of computers, and that sort of stuff. And I liked it, and it's still a sort of a hobby of mine to do that sort of stuff when we need to. But it wasn't something I could see myself doing for the rest of my life. And I was always a pretty good student too, but I was a really good student when it came to something that I liked, which was sciences, biology, that sort of stuff. So I went to college as a biology major, not quite sure where that was going to take me. Probably about my sophomore or junior year, I started spending some time with specialists in the area, some oral surgeons, an endodontist, and said, you know what, this could be something that I could do and I could enjoy, because it was pretty much the perfect mix between the biology, the sciences, which I liked, and the creative portion, which I liked from the architecture and design, that standpoint. And it really has turned out to be that. The things you see behind me are our CEREC unit, which allows us to make crowns and bridges and implant restorations here in the office. And it's not just like you snap your fingers and it's done. It takes a lot of artistry and time to learn that sort of stuff. But that's my favorite part of what we do here, is to be able to do that and have the entire case under my control the whole time. And we still do use the labs for certain things, but I enjoy the fact that I can take the case from start to finish completely. Like I said, the artistry is what I really enjoy about that.
Cool. Tell me more about the CEREC machine. Is that like all in a one-day procedure?
Yeah, so it's pretty neat. We actually just finished one a few minutes ago. He came in at 9:30, and we got to take care of him completely in 2 hours and 15 minutes. He had a crown that was on the tooth that had decay underneath it, so we took it off and cleaned everything up. And in that 2 hours and 15 minutes, I was able to get the tooth ready for a new crown, scan it with the computer here is our scanner that lets us take a digital impression of it. Once we take the digital impression, then on the computer, I design the crown, I shape it, I make it exactly how it should look. I get the bite right on the computer, so we don't have to adjust the bite once we put it on the tooth. That saves a lot of time for the patient too. And then once it's done there, because it's a ceramic, it has to go into this little machine right here, which is just it's an oven, which hardens the material. It gets it looking like a nice white tooth. And right before it goes in there, I put some characterization in it to make it look like a nice, perfect tooth. And that's where the artistry really comes in. That's the part that I really enjoy. And again, it makes it a lot better of a result too in most cases, because I can see the other teeth that are alongside this tooth and match it up and make it look right, and add some characterization here or there depending on the person and on the tooth. So yeah, it's a one-day process. It usually, in most cases, most offices that don't have this, it'll be about a 2-week process where they'll prepare the tooth one day, put a temporary on it, and then from there, they'll send it to the lab. The lab will make it and send it back, and then have them back for a second visit. So in most cases, we do this not only in a day, but again, like we just finished up with the patient, about 2 hours, 2.5 hours, and it's done.
That's incredible to say.
Yeah, it's awesome. It's pretty cool.
You've kind of talked about a little bit of like dentistry is the right combination of artistry and science, but like, how did you know you chose the right field of healthcare?
That's a good question. Part of me enjoyed it from the very beginning. Even the didactic portion, going to school and taking the exams and all that sort of stuff. That's a long haul, but I did it because I liked it. I liked the material. And while I was in school, one of the best things I ever did was go on a mission trip to the Dominican Republic, where essentially what we did was just treat anybody who needed treatment, as many people as we could in that week that we were down there. And seeing these kids, adults, elderly people who just could not afford treatment or didn't have access to it, really opened my eyes to the fact that we're pretty lucky to have what we have up here, and we're pretty lucky to be able to do it the way that we do things up here. With the technology, like I said, but also to have the education, have the ability to do it. And that was one of the reasons that dentistry interested me in the first place, was I could help people. And there's not a whole lot of professions where you're able to help people, you're able to make a living doing it, you're able to enjoy it. And again, for me, it was dentistry, and that's what really opened my eyes down there, is we were able to help so many people who just wouldn't have had access to it before, not to any fault of their own, just because of their living situation, and to see how appreciative they were of it, and to see how much time they took out of their day to go back and thank us to do it, again, really solidified in me that's why I got into this. That's why I got into doing that sort of stuff. It was a great experience. I hope to go back soon. It'd be great to go back and help those people again as much as we can.
Yeah, I would imagine like almost the immediate, especially now with the CEREC machine, but like that immediate, oh, they get up out of the chair, oh my God, it feels so much better, or like, you got me out of pain, or you fixed this problem. That's one of the things I love in PT, of when somebody gets up and they're like, oh my God, it feels so much better. I would imagine it's the same in dentistry.
Yeah, it's easy to take it for granted because we do it every day, and patients say that almost every day. And so that's one of the reasons, like I said, I would like to go back and do that, because it's a little refresher to say, listen, this is not something you should take for granted, that you can do this and that you can help people and get people out of pain. Because when you're in pain, especially dental pain, people have said is a different kind of pain. And we're here, it's snowing out, and we're here, we're local. So when there's an emergency or there's a case that needs us, they know they can always pick up the phone and call. And if for some reason we're unable to get into the office, we can take care of them over the phone. And usually, most cases, we're able to come right down because we're so close, and take care of people.
Yeah, awesome. What do you wish patients knew before they came to see you? Let's say it's a brand new patient. What's something you wish they knew?
That's a good question. I wish they knew that dentistry, though it's very straightforward in most cases. A lot of patients that I've encountered have come here and said, no one ever told me that. No one ever explained that to me this way. No one ever showed me that. I didn't know that that was possible, or that we could do that, or that was even an option. I wish a lot of patients knew that right off the bat, that we're going to do what's right for people. We're going to do what's right for their health, what's right for their family, and what's best for them, in a manner that they understand. Because a lot of dentists, a lot of patients have told me that some of their previous experiences with dentists have just been, you sit down in the chair and you're the patient, I'm the doctor, and here's how it's going to go. That's not how I approach things, because that's not how, when I'm a patient for whatever it is, that's not how I like to, for other doctors to approach me as the patient. And so what I wish they knew was the fact that they can come in and ask any question that they have, any question that they want. No question is a dumb question. We'll take the time to answer any question, because my job is to educate people. A lot of people think my job is to fix teeth and make sure people's teeth are healthy. That is also my job, but my job is to educate people on how to do that and how I can help them do that, and come up with a plan if something needs to be taken care of, to take care of it.
I think that's really important. And I think a lot of people feel like they are at, I'm not going to ask it, or they get shy because they're like, oh, that's a dumb question.
I've had patients tell me that.
Yeah.
And that's a barrier to get over. And that's what I want them to get over first, because they've got to understand, before we do anything, patients need to understand what the reason is we're doing it, and the way that we're going to fix issues. And I tell that to all my patients first, because they need to have 100% confidence in what we're doing and in the decision that they made, before we do anything. That's a huge first step.
I think it like empowers them too a little bit. I feel like your teammates almost, instead of like the higher.
100%. 100%. I always tell patients, not for any particular reason, but I'll usually tell them that they did a good job once we finish up, and they'll say, I didn't do anything. And I'll say, well, yeah, you did. I couldn't have done it without you, first of all. And this is a team effort. This is a whole group effort. A lot of patients will come in and think they're just going to see me. They're going to see everybody in the office pretty much when they come in. Long-time patients will see the hygienist, and they'll say hi to the hygienist and chit chat with them on their way in, and how are the kids and that sort of stuff. That's the kind of practice that we have, is that everybody kind of knows everybody, and they want to see everybody when they come in. So the assistants will get to see patients, even if they're not treating them that day, they'll be able to see them and catch up with them real quick. And then, I'll obviously they'll see me, or whoever's treating them that day. So it's a nice thing to see patients come in and be able to chat with people that they know and they've known for a long time, that sort of stuff.
Yeah, and a team atmosphere.
Oh yeah.
All right. So what could a new patient like expect on their first visit with you? You did a good job of it sounds like you'd answer a lot of their questions, but let's say it's a regular hygiene visit. It's a brand new patient coming in.
Yeah, most patients who come in will come in first for their cleaning. Even if there's an issue, we like to get a cleaning done first. We like to get a full exam done first. And I like to get to know the patient too, and get to meet them and see what their expectations are and what they would like to get accomplished while they're here. Again, I like to educate patients, tell them, here's what's going on. I'll take a lot of photos. A lot of patients will say, oh, I've never seen photos of my teeth before. I like to take the photos of teeth so that they can see what I see and understand the issues. And then again, we'll come up with a plan for it. But at that first visit, it's usually they're cleaning with Katie or Josie, one of our hygienists. Then I will sit down with them, usually about 10-15 minutes, to go over anything that we see in the exam. I'll go over x-rays, that sort of stuff. And then we'll make a plan. We'll treat things sequentially in order of the priority that we need to, based on again what they want to get accomplished, what we need to accomplish from a clinical standpoint. And then they'll usually meet with Cindy, our office manager, too, to go over, insurance and finances and that sort of stuff. So there's no surprises going into things.
Nice.
Yeah.
Love it. So you mentioned you treat everybody. What types of people or who has the most success as a patient? And success is always a relative term. But like, what type of person has the most success as a patient of yours?
The patients who have the most success are the ones who have confidence in themselves to do what we need to do. That's the first thing, because then the fact that they come in, that they walk in the door, shows that they're confident in what they want to accomplish here, and they trust us to point them in the right direction. And if they decide to pursue the treatment, to pursue it. But the patients who believe in themselves and believe that even if they haven't been to the dentist, we have some patients who come in for the first time who haven't been to the dentist in 10 years. And they say, doc, I've been putting this off for a while because I don't know, what you're going to find in there. And I don't really know if I can move forward with it. I don't know if I can do it. And part of it is having them understand what's going on and what the situation truly is, because a lot of the times it's not as bad as what they think it is. Mm-hmm. And getting them, past that barrier of, oh, I don't know if I can do this or want to do this. A lot of patients don't want to do it, and I get that. But in the end, all of our patients, once treatment's completed, are happy they did it. They're glad that they took the confidence in themselves and they took the next step to come in and get it done. But patients who believe in themselves and believe in what we can do for them, they're fantastic cases. Absolutely. Cool.
Just to jump off of that a little bit, what do you say to somebody who's like, I'm not ready for this, right? Like, if the next step in care is, okay, we have, I'll use a simple case, right? We have a cavity to fix, and they're like, I'm a little nervous to do that. Like, I'm not there yet. What do you say to them?
I empathize with them because it's easy for me to stand here as the dentist and say, you need this, or you need this, and here's why. And say it's as simple as that, and we'll get it done. And it is straightforward. Everything we do is predictable and straightforward, and we have a plan going into it. I understand some patients' apprehension beforehand because they've heard other stories. A lot of patients will say, oh, I heard, my friend had a root canal and it was terrible. And I'll say, well, usually you're not going to hear about the great root canals. Nobody's going to be walking around saying, I just had a great root canal done and I can't wait to have the next one. But my rule in the office for patients is I have one rule with patients, and that's if there's ever any pain or any discomfort, your job is to tell me or tell someone on the staff, because there should never be any pain or discomfort while we're treating it, because we have things to get rid of that. Yeah. Usually that's what it comes down to, is patients' apprehension, because they've heard other stories from their friends or as a child, that sort of stuff. And we have ways around that. We have nitrous oxide here that we'll use for some patients who need it. There's some certain medications that we can use for patients if, again, they feel it's necessary or we feel that it's necessary. But there's always a way to get the treatment done, and there's never been a case where we haven't been able to get it done because of our expertise, because of the technology, because of the things that we have on our side in our armamentarium to get things done. We can always accomplish things. So there's some patients who, yes, say, I don't know if I'm ready to do this. And usually, if we inquire further about that, it comes down to they haven't heard great things from other people about that procedure, or they had a bad experience as a kid. And that's, like I was saying earlier, I think we're a little bit of a different practice because we will take the time to make sure everybody's on board and 100% confident before we do anything.
Yeah.
Absolutely.
Yeah. Awesome. What's one question you wished patients asked you more?
That's another good one.
Thanks.
One patient, I wish they asked me more. That would probably be, is there another way to accomplish what we want to accomplish? And patients don't know to ask that in a lot of situations. And so it's usually I will get to that point in the conversation anyway, because I want to give everybody their options and explain what we can do or what we should do. And then have the patient go from there. But again, because new patients might not be used to asking that question to their dentist. They're just expecting an answer. They don't know to ask that. I think having them ask that, or if they were to ask that, that shows that they understand that there are options. There's different ways to treat things. There's usually not one hard and fast way just to treat something. And that's the beauty of dentistry, is that teeth usually tell you what to do, but they don't tell you how to do it. There's usually a lot of different ways that you can accomplish things. We try to treat things in order of priority, priority from a clinical standpoint and also from a patient expectation standpoint. But that's one thing that patients, I would hope, know to ask. I think some are either apprehensive or they just don't know to ask it. But asking that question gives us a whole new conversation to have. And again, having that conversation makes sure everybody understands it, patients understand it before we move forward with it.
I like that too, because I'm sure there's a lot of ends of that spectrum of like, again, I'm not a dentist, I won't try to be, right? But all right, we could pull the tooth, right? That's an option, right? We could fill the cavity, that's an option. We could leave it and it's not going to get us the result we want, right? And it's nice to know that you would walk people through, yep, here's the spectrum, here's every stop we could make along the way based off of, our relationship, or based off of what you've told me so far, based off of what I see, like this is the route I would recommend, but sure, there's other ways.
Yeah, and there usually are. Again, sometimes there's certain things that necessitate being treated in one way or one manner. Just certain cases tell you that. But a lot of cases, there are options, and there's a lot of considerations that go into those options. But another thing that I wish patients understood a little bit was not just what are my options, because the next question after that would probably be, what does my insurance cover?
Yep.
And the tough part about insurance is that a lot of people will consider it like it's an end all be all, like it's going to cover everything. And what we found recently is that insurance has cut what they'll cover, keeping the premiums the same. They'll cut what they cover and then not really inform patients of that. And patients will sort of be under the assumption that that's going to be covered by my insurance. And if it's not, then it's wrong if it's not covered by my insurance. But that's usually a barrier we have to get over too. Once we look at our options, because you can't throw finances out the window, but we can't let finances, or insurance for that matter, dictate what we do. Because my job is to take care of patients, provide the best treatment possible within a range, a financial range too. And insurance is good. It gets you a little bit of a discount, but in most cases, insurance isn't going to do the best. They're not going to cover the best thing or the highest priority thing or the best way to treat it. But they're going to cover the not the cheapest, but usually the least expensive alternative. Sure. So instead of a white filling, they'll say, yeah, we'll cover silver filling. Or instead of saving a tooth and putting a crown on it and maybe doing a root canal if you need to, they'll say, we're not going to cover that part, but if you want to take the tooth out, we'll cover that part. So that can be a little difficult for patients to understand too, is that insurance isn't going to cover what's best for them. They're going to cover what's best for the insurance company usually.
Yep.
So that's a barrier we have to get over sometimes, but we do it. And that's, like I said, Cindy, our office manager, is always here for the first visit to go over that sort of stuff. she has a good handle on that.
Yeah, that's really helpful.
Yeah.
And again, just it sounds like you empower a lot of people to make informed decisions, which is all you can really do.
Yep.
Awesome. So you mentioned a couple things, right, that you treat, and you said you treat everybody, but like, what's an example of like one or two cases that walk through the door and you're like, you get excited to treat because it's like one of your top one or two things to treat. You're like, oh, good, good, I got an Invisalign case, or good, I got what is it?
Yeah, it's funny you mentioned the Invisalign, because really probably the top two things that I like doing is Invisalign and using the CEREC behind us. Like I said before, that's one of my favorite things to do because it involves a lot of artistry, and I have the case under my control from the time the patient gets numb to the time the patient walks out the door with that brand new sparkling crown in their mouth. And it's fun. I love doing that sort of stuff. I love it. Because not only are you fixing something, but you're fixing something and you're making it look right, and you're taking the time. And if you need to make an adjustment, we can make it here, as opposed to if we were to use a lab. If we wanted to make an adjustment, we got to send it back to the lab and do the process of waiting a couple of weeks to get it back. So that's one of my favorite. The other one is Invisalign. I don't think there's a coincidence that those two are my favorite, because again, they involve a lot of artistry and planning and design. And you'll get a fantastic result from it, provided that patients wear their aligners and that sort of stuff. And there are some cases that need an orthodontist. There are absolutely some. But the reason I started doing Invisalign was because we had a lot of patients who would come in for their cleanings and say, you know what, doc, this little spot down here, can we correct that little bit of crowding, or this tooth looks like it's not in the right position. And I got certified in Invisalign about 4 years ago. And before that, I had to say, yeah, you know what, the orthodontist that we use is down the street. You got to go there to do it. And they'd say, oh man, you can't do it here. And I'd say, let me correct this. Let me take the proper courses, get the right certification, and take the right CE to do this. And I did about 4 years ago, and it's been great. It's been great, because I had a patient again yesterday who we weren't planning on doing it, but she came in yesterday in the middle of her other treatment and said, hey, can we do this? And I said, yeah. And she said, please don't tell me I have to go somewhere else. And I said, no, you're the exact reason why you don't have to go somewhere else, because patients were telling me that they wanted to do it and do it here. And patients deserve that. So we're able to do it here in the office. Again, there are some cases that absolutely need the orthodontist, and they'll treat them just like we would, just like we would treat them, and vice versa. So it's a neat process, the Invisalign process, and I really like to see those cases that come in and things don't look exactly perfect, and then we can get them looking perfect within a matter of months.
Cool.
Yeah.
Love it. You kind of alluded to it, but like, was there ever a time that you had to like kind of concede, like, you know what, I'm not the right person to treat this, or like I got a good person for you to go to? Can you tell like a story around that?
Yeah. So I'm a general dentist, which means we can do anything involved in dentistry. But there are some cases that need the specialist. And the fact that some cases need a specialist isn't a detriment. It's the fact that we have specialists in the area that we know and have worked with for years and trust, and they treat us like family and we treat them like family. And if I ever need a specialist for something, that's where I'm going. And if my family ever needs it, that's where they're going, and vice versa. But we've had a couple of cases recently, actually, where the patients needed, they were at the point where dentistry had really done all that dentistry could do for them. And we decided to go with implant restorations for them. And an implant's nice because an implant stays in place, and then you can restore it however you need to restore it. In their case, what we did was they saw the local oral surgeon that we used, extracted the remaining teeth, put implants in, and then were back in our office and we're able to get them teeth that screw right into the implants, never took them out. They don't have to worry about it. They can do everything like normal and eat and chew and function like they normally would, and get them back up and running, in the best way possible in an affordable, reasonable amount of time too. So like I said, using a specialist is not a detriment. It's not like it's a failure on general dentistry's part to say, I want you to see the root canal specialist or the oral surgeon. It's the fact that in doing so, I can remain the quarterback of this team, and the specialists are working with us to accomplish the result that we can get. So it's not uncommon that we need specialists in the area, and that gets us the best result, definitely, when we do.
Yeah, cool.
Yeah.
Love it. All right. Couple more questions for you. You're doing great. I usually give people the questions ahead of time. This one I didn't give you. How do you best like practice what you preach, right? We all know like, okay, we brush our teeth twice a day and we floss and like you have kids, right? So like, just give me like a glimpse into like the day in the life of like, all right, how do you practice what you preach when you tell your patients advice? How do you follow your own?
I don't want it to be general, but what it comes down to is, like I've alluded to before, is that I want patients to ask questions. I want patients to understand it. And I want them to be 100% on board with what we're going to do and how we're going to do it. And so in my life, especially like with my kids, that's one thing that I try to preach to them and I try to do myself. I want to understand everything that I can, especially if it involves going to see a doctor or a physical therapist or whoever it may be. You got to make sure you understand it. So one of the things, literally practicing what I preach, is when we have little kids come in. Most of the time, you don't have to floss between little kids' teeth. And about, I don't know, maybe a month ago, my son, of all people, had a cavity between his teeth, and no fault of anybody's other than the fact that we weren't flossing his teeth. We weren't flossing his teeth. So, and in most cases, you don't have to. Now, every single night, we floss his teeth, and that's what I preach to my moms and dads who come in with little kids, is that even though they're baby teeth and they're going to fall out in a couple of years, and we don't have to take care of them, we certainly do, because it can lead to bigger problems, and we got to establish those practices early on, so that it can build a little bit of a foundation for them moving forward, and as they get older, get their adult teeth. So that's a literal example of it too. Yeah. But the biggest thing is I want patients to understand it, and that's what I try to do. Every aspect of my life, even outside the office, got to understand it. Got to understand the options and understand why you're doing it and how it's going to get done.
Yeah, I think that's not what I was expecting you to say, but I like it.
Oh, you're expecting?
I don't know. I brush my teeth twice a day. I floss every night.
That's the basics. I would hope everybody does that. I think. Again, sometimes they need a little reminder when they come in and see me. And yeah, you got to do that sort of stuff. But on a more general sense, I think it's important for me as the dentist here, and me as someone who, obviously, I go to my physician and I take care of myself as best as I can. So when I get advice from somebody, I want to understand it and I want to be on board with it. Because when I do things, I like to do them right and do them 100%, or really not do them at all. So that's the approach I hope my patients have. I hope they get that when I talk to them, is that I want them to be as involved in the treatment as I am. And again, yeah, you got to brush and floss. Definitely.
Love it. Awesome. All right. So tell me, I have a couple more questions for you, right? Who's had like the biggest influence you as a provider? Was there like a mentor or a colleague or somebody who, or like a book that you reference and Where
Um,
you're continuing eds, that kind of stuff. Talk a little bit about that.
so obviously, some patients might not know. Our dad is a dentist, and he's been practicing for 37 years, I believe, 38 years, almost 40 years. And working with him, he still practices, and working with him on a daily basis from the time that I finished school in 2013. Having him as a mentor early, from the clinical side, from the practice standpoint side, administration, that sort of thing, has been huge. There's no way I would be where I am right now without his guidance and following graduation from school 8 years ago. The same with there's a general dentist, Dr. Abernathy, who does more. He was practicing for a while. Now he does a lot more of administrative practice management type of courses. But he has stressed the fact that, we're doing what we love for the people who need it. And our job as providers is to provide the best care possible to as many people as possible. And so that's my goal, is to help our community. Again, it's the community where we work. It's the same community where we live, where we go to school and go to church and go to the supermarket. And I have the ability to do that. So that's something that he, along with a few other people, have reiterated to me was, our job is not just to do dentistry, it's to help as many people as we can. And that's really what hit home with me. So again, obviously having dad from an administration standpoint, and how to maneuver, running an office and taking care of staff, and having a great staff, which we have, and we're very lucky to have. That's one aspect of it. The other aspect is doing the best dentistry that we can and helping the most people that we can.
Love it. Awesome. If a patient needs you after hours, right, or after procedure, are you available, and how are you available?
Absolutely. Yeah, we're always available. We have an emergency line that patients can call, that we get a notification as soon as that patient will leave a message. If we're not in the office, obviously, if we're in the office, we will always do our best to get the patient in, immediately, even if that means having to shift some things around to do it, or stay a little late, or come in a little early to do it. But like I said before, I'm born and raised a West Caldwell resident. We're in West Caldwell. We live in West Caldwell. And so if there's ever, a need for us, whether it's a Saturday or a Sunday afternoon, we can make it to the office. I can make it here in 8 minutes from the house if need be. So that's one of the nice things of living local and being local, is that we can always be here. And whether it's a new patient or a patient who's been here for 40 years, we're here for everybody, and we're glad to do it.
Love it. I got one more question for you, but before I ask it, I just want to acknowledge you and say thank you for what you do in the community, and thank you for treating me all the times you have, and our family. And it's good to get your perspective on it from this end, because we talk about other things all the time, but to go back and hear your why, and to go back and hear the genuineness that you have for wanting to help people in the community, it's very sincere. So thank you for that.
Absolutely. Pleasure.
So the last question is where's the office, and what would be the best way if someone wanted to be a new patient? How would they reach out to you?
Sure. The office is right here in West Caldwell. We're on Harrison Avenue, 31 Harrison. We're right across the street. We're on the border of West Caldwell and Roseland. So we're a traditional sort of practice. We're not in a big high-rise building or in a big office building somewhere where we're hard to find. We're right on the corner of Harrison and Norton. It's a converted house, essentially. But we have all the amenities here, all the technology here to take care of people too. So We're easy to find, especially people who know the area. We're right on the other side of West Caldwell. Obviously, patients can always call the office. They can always call and leave a message if we're not here, if it's after hours for an emergency. And our website obviously is 24/7 too. Patients can get in contact with us there. That's josephsendental.com. We're on Facebook and Instagram, all the social media sites. You'll see a lot of pictures of my kids on there because they're cute. No shame in that. However, they're getting their teeth, and what I like to do on there is to keep patients informed as to what development of baby teeth to adult teeth can look like, and his teeth fall out and teeth come in, and how we brush and that sort of stuff. But you'll also see a lot of pictures of the staff and patients and cases that we've done, and they can always send us a message on there. We're on that on social media, pretty much 24/7. We have access to that too. So there's a lot of different ways, and we'll always encourage patients to ask questions or inquire, however is easiest for them.
Awesome. Love it. Is there anything else you want anybody to know?
I think we covered a lot of stuff, but yeah, we're always here for people. We've been here for 40 years about. We have a fantastic staff. We love to take care of any and all ages. Again, there's never been an issue that we haven't been able to treat, and that's not going to change. So if patients have questions, if patients are curious, or if they're looking for a new dentist, or just looking for an answer to a dental question, we're always here for them. I'll be happy to take care of them.
Awesome. Thanks.
You got it. Thanks for having me. This is great.
Yeah.